Hi, and good evening. I'm Dr. Philip McMillan. Thank you for joining me as I focus on an interesting paper that I'll be looking at in this today's discussion, looking carefully at what they call misinformation, trust, and the use of ivermectin and hydroxychloroquine for COVID 19. So I'll be going through this paper, and that's why I'm allowed to say those words, just in case anyone is looking out. I've only said it in relation to the paper, but it's about what the paper showed. Conspiracy-mindedness, an interesting term that I had not heard of before, and how that characteristic of individual may influence the reason that people take or don't take the COVID vaccine. Now, this fits right into what I'll be doing in the next week and a half, and you can join me for this webinar as I'll be discussing some of those very same interesting bits of medication and other things that could help for what I consider the next wave of the COVID 19 pandemic. Now, some people would say that's not likely to happen, but I believe in preparedness and I believe in looking at all the options. So it probably indicates that I'm in the category of the conspiracy minded thinking. So, if that is of benefit to you, remember, join me on the webinar. The link is in the description, and you can register it for a week coming up on Thursday this week. So, let's get into what this paper was about. And so, this is a JAMA paper, and it was just published on the 29th of September 2023, and it looked at misinformation, trust, and the use of ivermectin and hydroxychloroquine for COVID 19. It was the primary author was Roy Perlis, and as usual, I usually check to see if there are any conflicts. And looking at the conflict of interest disclosure, he received personal fees from Burrage Capital, Genomind, Takeda, Psych Therapeutics. It doesn't stand out to me as anything particularly concerning, and the funding was from the National Science Foundation. So essentially, the paper, I think, is likely to be objective when it comes to looking at what they were focused on. And so in the paper, here were the key points. And the key points were to do with how much were beliefs in misinformation and trust in institutions associated with individuals' use of non evidence based treatments for COVID 19, including ivermectin and hydroxychloroquine? I think it's an important point to clarify here because you find that the scientific community is very much into the argument of evidence versus no evidence. I think they have to be careful because at the moment, the primary strategy that is being used across the world with regards to vaccination, especially boosters, there is very, very limited evidence as to the benefit or risk. And so, if your focus is purely based around evidence, you have to be careful that you don't corner yourself into doing non evidence based things that you support as opposed to non evidence based things that you don't support. That's my warning to the scientific community. Very careful at this point because there are some factors that you have to take into consideration that you don't quite fully understand. I'll give an example. I recently did a presentation on Honduras being censored in December 2021. They did a remarkable job at protecting the lives of their citizens, came from the government level of the country, and these were their outcomes over that period of time. And you can see here that this was early in the pandemic. They had some of the worst outcomes in terms of deaths. These are cases, and they rapidly fell off, and this is where Honduras was up to the 6th of September 2023. The truth is that they were using some of these non evidence based methods. Now, I'm a scientist, I'm practical, and I look for solutions. And my rule is I don't care what works. I just want to understand why it works because that is very, very important. And so when you look from a scientific perspective, And I've used the example previously for Papua New Guinea. At the time, they only had 4.15% vaccination uptake. And for them, the pandemic was over. And so, therefore, once you look scientifically, you expect consistency of results. And if you don't see consistency, then it's incumbent on the scientific community to explain the mechanisms as to why that would occur. So you're having countries like Honduras getting exceptional outcomes using non evidence based treatments. And you have countries that have used evidence based treatments who are now struggling with the wave of COVID 19. So it really raises some big points. But let's get back to the paper. So let's start off with what exactly they looked for. They were looking at 1,348 adults across 50 US states, looking at who reported probably or definite COVID infection, and 6% reported the use of ivermectin or hydroxychloroquine. And so they were trying to understand that group. And those who endorsed COVID vaccine related misinformation had lower trust in hospitals and physicians and lower trust in scientists and exhibited greater belief in conspiracy theories. And they were more likely to report using one or more of these medicines. And so that's where the paper was going from. They were looking at, they were genuinely, it seems, trying to understand, well, what would make those people not listen to the trusted organizations and do exactly what they said? Why would they believe in conspiracy theories? And just to clarify what they were using, this is an example of the kind of scale they were using. This is from 2020, the psychometric assessment of the generic conspiracist belief scale. And so this is a widely used measure of general belief in conspiracy theories. And they look at 5 related but distinct factors. So this is what it would look like. It's looking at the government, whether you can trust the government, whether or not there's some terrible global conspiracies going on, whether or not there's extraterrestrial cover up, personal well being, control of information. So those are the 5 main areas that they think that people who are prone to conspiracy theories will primarily be focused on. And that's what they were using, a similar kind of assessment when they were looking at the people who responded in a particular way. And so I was very interested in the patterns. But it's important to clarify that when we say conspiracy theories, you have to remember, and this is why I said the scientific community has to be careful, because there was a tremendous conspiracy theory going around early in the pandemic that the virus was leaked from a lab. Now, that was an awful conspiracy theory, and I don't know why people at the time would even have considered that possibility. I mean, it's purely coincidental that there is a lab developing viruses and working on viruses close to where the epicenter was, but that was just coincidental. But then, for the conspiracy minded people, what do you think happens when they see this coming out? And this was just coming out on the 24th of September 2023. The China lab suspected of COVID leap stripped of US funding for violating biosafety rules. I recently covered this. The Wuhan Institute of Virology broke rules that were with increased viral activity more than tenfold. And so the US, who was funding them, who said that they weren't, then pulled the funding that they weren't actually doing. That's an example of a conspiracy theory that actually wasn't a conspiracy theory. So it would be very interesting if they did a similar conspiracy theory scale looking at naivety mindedness scale. So they look at the opposite end, those people who don't question anything, who go along completely with what they're told, even if what they're told doesn't necessarily make sense. That's the naivety minded sense. And it would be interesting to see what the outcomes of those kinds of research would be. Anyway, let's get back to the paper and look carefully at who was falling into these categories. So this is one of the tables in the paper, and I'll show you here. So they were looking at the logistic regression models, looking at associations with those receiving non evidence based medication treatment for COVID 19. And so when they looked at that, they found in effect right in the middle here, the 18 to 24s were the midline. 25 to 44 were more likely to receive non evidence based treatments. The group who was least likely to receive that based on age were the over 65s. And quite truthfully, that makes sense to me because, in the context of COVID 19, the over 65s would have been the highest risk for severe COVID 19, and therefore you could argue would benefit the most from vaccination. The younger age groups were at much lower risk, especially if they had no comorbidities. Interestingly, male and female, males were far more likely to receive treatment compared to females. That's interesting. The group that is most likely to receive non evidence based treatments were college based graduates. Now, isn't that very interesting? The group that was most likely to not receive it were those who had just some high school degree or less. As we look at income categories, you can see here over 100,000 were the most likely to receive non evidence based treatment. Very, very interesting. I said it's fascinating looking at who does what. And again, when you look at the communities, the Hispanic community were the most likely to receive non evidence based treatment. That makes sense to me when you look at outcomes in countries like Honduras. They would know this. And lastly, down here, you have by political party Democrats right on the midline, Republicans slightly leaning towards non evidence based treatments, and very unlikely to receive it are independents and other. So, this is the kind of information that has come out from that. Very interesting to analyze because I think it's going to be relevant going forward because we're at a transition point where I'm not sure how the main agencies are going to convince people that what they say next is absolutely going to work. How do they know what to trust? I think that's going to be a huge challenge because people have been reflecting carefully on some of the outcomes around them. It's very difficult to turn that back when it comes to what is happening. So let's look at what happens with regards to treatment based on, and this one now is looking at survey weighted um, of non evidence based treatment use or US Food and Drug Administration approved treatment use for respondents who describe some or a lot of trust in a given institution. So this is now about using uh, evidence-based, so to speak, treatment. So when you look carefully at it, for they've broken it down actually. Non-evidence-based treatment, looking at physicians and people in hospitals, they are far less likely to use non-evidence-based. But for FDA approved treatment, they are most likely to receive treatment. And that's borne out in the fact that most of the hospital workers have been vaccinated because that was the recommendation of the FDA. In terms of the pharmaceutical industry, for non evidence based treatment, what's interesting again, they were more likely to receive treatment and also for FDA approved treatment. So they seem to have gone both sides of the fence, so to speak. It's very, very interesting for the pharmaceutical industry compared to scientists who were very less likely to receive non evidence based treatment, but again, were weighing towards the FDA approved treatment. Social media certainly had some impact. And again, you can see the split, even for non evidence based treatment, that's still higher than the FDA approved treatment. So that had a factor. And when we look at Donald Trump, for people who were responding to that, for non evidence based treatment, they were strongly leaning towards most likely getting it. versus the FDA approved treatment. So it's again quite an interesting breakdown of patterns that we had. And I found it interesting that they highlighted Donald Trump in the mix. And I, there are two sides of the story with regards to what happened with Donald Trump. I'm one of those who believe that he should not have interfered in the scientific process by making it political. So, the minute that Donald Trump spoke about the benefit of hydroxychloroquine, he changed the position from science to politics. And suddenly, from a Democratic point of view, they had to make sure that didn't work because it would damage them politically. And that, I think, caused lots of damage to the whole scientific process once politics got involved. I wish that nothing was said. I wish that we would have had the opportunity to just look objectively at the science to see what worked from what didn't work. And so that I think is quite a sad thing in terms of what had been the outcome with regards to what was going on. And again, as we come to the conclusion of the paper, I'm just getting the conclusion of this paper here. They recognize some limitations with regards to it. And here is the conclusion. What they found is that in aggregate, and I'll use my highlighter here. So, in aggregate, the survey suggests that the potential harms of misinformation may extend to prescription of ineffective and potentially toxic treatment rather than simply avoiding health promoting behaviors such as vaccination. I think that they should have probably timed this a bit better as we move into the winter and the booster campaign, because you want to know if you're going to say something like that, that this is likely to be beneficial long term. I'm saying that very carefully, and you have to look out for one of my next discussions where I talk about the variant, the Omicron variant 2.86 and the impact that the fact that it is not neutralized, within the vaccinated cohort with their antibodies. That's a really significant pattern that we have to look out for, and why I anticipate that this winter in the northern hemisphere could be extremely difficult. But the main point of this is that it seems that we have two sides of a coin here. The conspiracy minded people were less likely to move quickly to take on the vaccines. It seemed as though they had more financial um, capability, they had higher education in terms of college degrees, and they were more likely to be listening to social media and Donald Trump. So this is what I think the takeaway is from this paper. The fact that some of the conspiracies seem to no longer be conspiracies and are actually true will embolden that cohort to think that they made the right decision. And certainly when it comes to vaccination, one of the very interesting patterns is those who have not yet been vaccinated are probably very low probability that they will start taking a vaccine at this point. So they are very clearly entrenched in their position. The question is what will happen longer term in terms of the trust in major institutions. Will the general public become more and more conspiracy minded in terms of their leaning, or will they remain in their current position? And seeing how that plays out over the next few years, well, months to years, is going to be very, very interesting. So, thank you very much for joining me. I hope you found this information valuable. And again, I remind you that if you are interested in some of our educational courses, please join us. And that's going to be a link in the bottom. And more critically, if you are interested in the upcoming webinar here, this is on how to prepare for the next wave of COVID-19. As I look at some of the strategies, some of the medications that were mentioned, why they work and what could be done, and how they could be used together, that's a very important pattern that I think is worthwhile discussing and reflecting on. So, have a good evening, everyone, and I will speak again soon.